Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. I'm Colin Hung, and I'm about to sit down with Carlos Aros, the Director of Operations from Community Health Alliance. Carlos, welcome to the program.
Thanks for having me. I'm happy to be here.
I'm excited because we're going to talk a little bit about your use of the patient portal and the campaigns feature inside eClinicalWorks. That's not something we've explored before, so I'm excited to dive into that with you. But before we get there, tell me a little bit about yourself and Community Health Alliance.
Well, yeah, I'm happy to share that. So like you mentioned, I'm Director of Operations for Community Health Alliance. We are a nonprofit federally qualified health center. Our service area is Washoe County, located in Reno, Nevada. The county itself has around 500,000 for population, but our patient count right now is a little bit over 27,000 unique patients that we serve. We have 6 brick and mortar clinics located around the Reno Sparks area, and then we also have a mobile medical unit that we consider as our 7th location, where we go and see homeless patients every week on Thursdays. We offer a variety of services to our patients, primary medical care for adult and pediatrics, behavioral health. We have an in-house prescription food pantry program, in-house pharmacy, and we have WIC services and dental services.
Amazing. I mean, all the services that any of QHC provides is just incredible to the community and so needed.
Yep.
But I want to talk to you about the portal, because we know a portal can help with access to care, which is very vital for what you do. But tell me a little bit about the portal itself and how you've encouraged patients to adopt it.
Yeah, so our patient portal went live in July of 21, and it's gone very well for us because our patients have responded to it very positively, because for us, when we're talking to the patient about enrolling them, we're making it relevant to the conversation. So for example, if they can't make it to their appointment, we tell them, if you get on the portal, you can just send us a message and we can reschedule your appointment or we can cancel your appointment. If you need to get an important message to your doctor, you can go ahead and send that message to us through the portal. So we try to make it relevant so that way they can, focus their time on other things that they got to take care of. But if they need to get in contact with us, they can do it from the comfort of their home, with their iPad, with their smartphone, or on their desktop at home.
Right, so you're making the portal in context of something relative to the care, not necessarily just a place to get like their record or something like that. You're saying, hey, if you can't make it to your appointment, let us know through the communications channels in the portal.
Correct.
And what's the uptake been? Like how many people are using it now? Is it achieving the goals that you set out for it?
Yeah, so right now out of our unique patient count, we have a little bit close to 18,000 unique patients that are web enabled, right? So that's almost 70% of our patient population. And out of those patients that are web enabled, our engagement rate is around 27%, meaning those are the patients that are logging in, they're viewing messages that we've sent them, they're looking at their aftercare visit summaries.
And what effective ways have you used or found with your patient population to get them to use the portal? I think it's one thing to get them to sign up for it, but to actually engage with it. Are you finding that it's just a verbal reminder every time they come in? Or do you phone them to let them know they can use the portal?
Yeah, so verbal reminder with the patients, but then also is constantly bringing it up to the staff, right? So for instance, our call center, front office representatives, for the medical assistants. Making sure that it's on their radar and that they're doing their part to promote it as well, because we've focused with the support staff that if we can increase our user rate for the patient portal, we'll see the effects of it in the long run, where we'll see less inbound calls for things that can be taken care of through the portal, and then less outbound calls to make to patients as well. So saving time and resources.
Now, I understand you're doing a lot of surveys through ECW as well. Tell me more about that.
Yeah, so we utilize the post-survey campaign through ECW. We've been using it since January of 21, sorry. And then through the post-visit surveys, we send out around 6,700 text messages a month. And then through that, we get good quantitative feedback. And then we care what our patients tell us about their experience. So what we do internally at Community Health Alliance, that if a patient shares a comment through that survey that they had a negative experience, we do service recovery. We follow up with them. We let them know what happened, what can we do better next time. And then we also look at other metrics within that survey to where patients tell us how easy it is to get an appointment. Do they leave the office visit knowing the treatment plan that their provider has them on? Did they go over all the medications with them? Things.
So these are custom surveys that you're building within the ECW product.
Yep, English and in Spanish, custom surveys.
And then you're sending those surveys, it sounds like, via text message to your patients.
Yes, those get sent out to our patients that are text enabled. So when we check you out as a patient, you get that text sent to you 24 hours after you're seen. And then say, you get busy, you haven't looked at the message, we'll send you your first reminder 7 days after the initial message.
Amazing. It sounds like patient engagement is very, very critical to what you do, very critical to your strategy.
Yeah.
What are some other things that you're doing to engage with patients?
Yeah, so we've also utilized the self-check-in kiosk as well at our health centers. And you know what, we did it as a pilot to see, let's just activate it, configure it, train the staff, and let's see how it goes, right?
Right.
And we had fairly good success with the pilot that we did for the self-check-in kiosk, where we provided the option to the patient where you want to check in with the iPad or you want one of our front office representatives to help you out. So that's the approach that we took with that pilot. And roughly we had around 400 check-ins in about a 6-month period.
Nice, nice. So is it going to become a viable option for you down the road?
Oh yeah, definitely. Being here at the user conference and looking at all the upcoming bells and whistles. So we're excited for those features to be able to activate them and provide them to our patients.
Speaking about that, is there anything you're seeing here at the conference that you know of that eClinicalWorks is working on that's exciting? That's exciting for you, that you're going to be excited to implement?
Yeah, everything from the keynote speech yesterday with AI, that's really fascinating. It's a game changer.
It's going to make your clinicians a lot more efficient, and I'm sure it's going to help your patients as well with a lot of things.
Yeah, definitely see tons of room for improvement with efficiencies, and with the use of SoNu.ai, that's really exciting.
Last question for you. As a FQHC, you have to be very resourceful. You don't have a ton of resources available to you. So what advice would you give to other FQHCs out there who are maybe struggling with their portal use and maybe didn't have quite the uptake that you did?
Yeah. Well, FQHCs are all about the mission, right? So let's not reinvent the wheel. Let's collaborate. Let's network. Let's talk to each other as to what's worked and how can we take what you've been able to have as success at your health center and how can we implement it. So that's what I've always encouraged colleagues throughout the years, is that we got to network and leverage that network to our advantage and collaborate, because at the end of the day, we're all in it for the same reason, for the mission to help out the patients, because we are the safety net for those that are uninsured, underinsured, and have a tough time navigating the system.
Carlos, you've shared a ton of great information with me today. Where can people go to find more information about Community Health Alliance?
Yeah, our website, CHA, and then it's Nevada, spelled out NEVADA.org. And then check out our website and, get the healthcare you deserve with us.
Awesome. Carlos, thank you so much for being on the program.
Yeah.
Really appreciate it.
Thank you for having me.
This has been Colin Hung with Healthcare IT Today. I hope you enjoyed this interview, and if you did, please like and subscribe. Also, head on over to healthcareitttoday.com where you can find more great content like this. Thanks for being here, and I'll catch you on the next video.